Hi, my name is Nancy Sakachi, and I'm the founder of D.R.E.S.S and the D.R.E.S.S Family Community Facebook page. So happy that you're here today because I'm going to be reading a lot of the significant information that's transpiring on our D.R.E.S.S Family Community page, things you may not get a chance to hear. And since our latest patient survey, with 127 respondents, we have now covered 24 states, 12 countries, 36 offending drugs, and out of those 127 respondents, we've seen 112 hospitalized. So again, we are here learning about D.R.E.S.S syndrome. What is D.R.E.S.S syndrome? So D.R.E.S.S syndrome is drug reaction with or without eosinophilia, systemic within your system, and symptoms. It's a severe adverse reaction to a medication that can be life-threatening. So today I'm just going to share a couple of the questions that are posted on our D.R.E.S.S page. I call our D.R.E.S.S family members D.R.E.S.S family members. We have a reach of over 3,000 at times, but we have about 205, 206 cases, and some have passed, but the majority are actively fighting and dealing with D.R.E.S.S every day, some for multiple decades, some are new. What I was told, it can be 50 to 200 drugs. So far I'm seeing about 36 drugs. We are safe to say there's about 50 drugs that are commonly inducing D.R.E.S.S. As people continue to take medications, as we have global epidemics of things, we're going to need more antibiotics, we're going to need to use drugs that are D.R.E.S.S-inducing drugs. We really need to know what we're doing. We need to know how to identify this when it comes into an ER or into a doctor's office, and ultimately find a test that can be taken that will allow us to know if someone's going to have an adverse reaction, like what happened to Izzy Tolliver and my daughter Hannah. So for those of you who don't know my story about Hannah, her diagnosis was minocycline-induced D.R.E.S.S with multiple organ failure and myocarditis. She was published in the medical journal. She was one of the third cases ever published, and that's kind of what set me on my journey 8 years ago, and here we are. So thank you for joining. I'm going to read this D.R.E.S.S family member's question. I had D.R.E.S.S in 2012 and had a second episode, but much milder form, and only required 2 weeks of steroids. The first episode was several months of healing. I'm very careful about medication that I take and can now diagnose it much earlier. So certainly we're learning about our bodies, and the self-report is imperative. You have to fight for yourself with D.R.E.S.S. You have to make sure someone understands that you're experiencing something when they're not believing that you might be, or not understanding what your experience is. That self-advocating for your health is imperative in D.R.E.S.S. And also tracking with yourself. You know when something isn't feeling right. And because D.R.E.S.S can be so ambiguous, it's very important to track with yourself. It's one of the first things I did before I had any medical assistance, is make sure people understood to look underneath the skin, to make sure that they understood that this is not just a rash, that the prednisone can actually be covering up organ failure. And as you lower the prednisone, which should be in tiny increments and really slow pace, from what I understand from the experts, you can't really miss the heart. If you do, sometimes they pass before you get a chance to do anything. It sounds like that's what transpired here. Somebody said, has anybody else developed D.R.E.S.S from Lamictal? Big yes. 367 people piped in. That's what caused my niece to have D.R.E.S.S. The next one, my husband passed away when he was taking this and got D.R.E.S.S. I'm so sorry. I know it almost killed me, only after taking a non-therapeutic dose for 8 days. So the timing is very important, because with D.R.E.S.S is a delayed reaction. That's one of the differentials. And delayed reaction generally, from what I understand, is 21 days, around 21 days, which does allow the drugs to infiltrate you more. And in the case of the drugs that seem to get in the heart and other places such as Bactrim and minocycline. This is part of the problem. So by the time we realize we're having the issue, the fever, the giant glands, the rash, D.R.E.S.S has already infiltrated the body, and then it's becomes somewhat of a runaway train, depending on how bad the reaction is. Someone else said my son was on it for 2 weeks, then D.R.E.S.S occurred. Someone said, yes, my daughter got it from Lamictal, yes. Yes, I was on Lamictal after 5 weeks on it. I developed D.R.E.S.S. People talk about how rare this is, but here's the people. When I started, it was, everybody said how rare it is, but I decided to try to see who else was out there. So rare doesn't really matter if it happens to you, and rare just means it can happen. And it's important to remember that if that patient of yours or that family member of yours is having an experience that you're not sure about, give that extra listen. I'm new here. In 2012, I got neuroinvasive West Nile virus and I developed seizures. I was put on a medication called modafinil to help mental processing and developed D.R.E.S.S syndrome. I was treated with the IV steroids and then 100 milligrams of prednisone and was on it for about 6 months until resolution. Because of the seizures, I was prescribed a new seizure medication a year later and developed D.R.E.S.S again. So I have had it for a total of 4 episodes. I now suffer from a variety of autoimmune and GI issues as a result of the D.R.E.S.S. I can no longer tolerate any medication without triggering D.R.E.S.S reaction. When I was first starting this, none of this information was there. I really thought it was just, maybe acne meds, which have turned into antibiotics. So acne meds are antibiotics often now. And so while everybody's worried about the superbug, you have the issue of, antibiotics being given. And I know in our particular case, there was no medication asked for. It was originally just a facial my daughter had gone for, and this kind of thing is passed out so easily. And in America, minocycline is passed out by many different types of doctors, not just dermatologists or experts. And in Europe and France, you have to be, a specialist to give this. It has to be the last choice. And here, we're passing it out like candy. Hope you learned something today. Hope you check back in. I'm Nancy Sakachi. My book is Hannah Was Here, D.R.E.S.S, An Alarm That Must Be Heard. This is unfortunately what it's like for our D.R.E.S.S family members every day. We're counting on the medical community to listen, to pay attention, understand that not everything has been taught yet, and we're seeing more and more adverse reactions in people. Thank you so much, and have a great day.